Hi, my name is David Emerson. I'm a long-term cancer survivor and director of People Beating Cancer. Welcome to the vlog post about a topic that is near and dear to my heart, cancer and insomnia, or difficulty sleeping. Let me state from the beginning, while sleep issues is certainly a challenge with my specific cancer, it's an issue with virtually every cancer. I belong to a number of different online cancer groups, and it's commonly asked, can't sleep, I'm exhausted, how can I sleep, who takes what do you do, all of that. These are the tips that I have found have helped me, and that research has shown can help. First and foremost, it's important to establish that chemotherapy, cancer treatment has been established that it disrupts the cancer survivor's circadian rhythms. And that's not just steroids. Anyone who's been on steroids knows that you're wide awake for 12, 24 hours or more, but a person's circadian rhythms are all discombobulated. Your challenge as a cancer survivor is to try to discipline your body to get back, to redevelop your circadian rhythms. Let me go through specifics in that case. So in my case, and this is common, certainly steroids, chemo, the side effects that we develop, whether they are short-term or longer-term, such as gastrointestinal difficulties, pain. In my case, it's been years since I completed active therapy, and I still have joint pain, which disrupts my sleep. So when I talk about reestablishing sleep hygiene, it's generally referred to. Pain is an important component of that. So my wife and I, our son has grown and gone, so it's helpful to have, after dinner, the house is quiet. I can get to bed regularly on time. Reportedly, according to research, blue light, that light which screens emit, disrupts our sleep schedule. So no screens, hopefully an hour or two before. So a regular schedule, no screens. Drinking, going to bed drunk is bad for your circadian rhythm. People fall asleep quickly, but they'll wake up and cannot get back to sleep. In my case, I put on ointment in order to quell the joint pain that I suffer from, avascular necrosis it's called. That helps me relax, so I sleep better. For example, I used to wake up about 3 or 4 times shortly following therapy. Now I only wake up maybe once every night, which is pretty good. So moderate exercise during the day, as if I can tire myself, I'll sleep better. So nutrition, exercise, moderate exercise. Okay, naps. When we're tired, when we're fatigued, when we don't sleep well, we are all tempted to take a nap. It's challenging because if we nap too much, we won't sleep too well that night. Yes, I take naps, but they're basically sort of short power naps. So in the case of the things I just rattled off, sleep hygiene, exercise, nutrition, no screens, no drinking, moderate exercise, all of those things add up to, as I say, I toss and turn a couple of times, but basically I can get a pretty good 8 hours every night and that's only waking up, truly waking up once, tossing and turning a little bit. I think that's pretty good. If you have any questions, scroll down to the blog post linked below. Let me know. I'll do my best to answer any and all questions. I'll get back to you ASAP. Thanks for listening, and hang in there.